Hi there, I'm Dr. David McLaughlan, consultant psychiatrist at the Priory Hospital, Roehampton. As part of the Priory's Reset newsletter, I'm here to answer your questions about mental health. So our first question has come from somebody who says, due to severe bullying in my childhood, I lack confidence and self-esteem. How do I improve my mental health to overcome imposter syndrome and that feeling that I'm not good enough? So around 70% of extremely successful people, CEOs, lawyers, accountants, people from all walks of life will experience imposter syndrome. Now, often, as with this person here who's asked this question, it's rooted in our early life experiences, early childhood experiences, where we may have been rewarded for perfectionism, or we may have experienced excess criticism, and it develops this kind of cognitive lens where we don't necessarily recognize our own talents or our own abilities, and you have this horrible feeling that you're going to get found out. It can spike at different times in our life, particularly transitions. So when you're starting a new job, or you're doing a job interview, maybe if you're doing a social media video like this, ironically talking about imposter syndrome, or maybe even entering a new group of friends, a new social situation. And in these new kind of social situations, or I guess kind of career situations, your brain is kind of activated to look out for threats. We're looking for danger, and specifically a part of your brain called your amygdala. When we've had early life adversities, like in childhood, like we've been bullied, or experienced excess criticism, we can estimate the likelihood of those threats, overestimate the severity of those threats, and then we underestimate our ability to manage and navigate those threats. And so that's what creates this kind of cognitive distortion where we misread the world around us and we actually underestimate our own abilities. How do you manage imposter syndrome? So I think the first thing to know is you are not alone. There are lots of very successful people who experience imposter syndrome. So talk about it, be open about it, tell people what your kind of concerns and worries are. And you might find that the person that you're talking to can also relate. The other thing I suppose to recognize is that it's something that you can gently challenge and change some of these kind of inbuilt kind of views of yourself and the world around you. So checking it is a way to do that. So just checking with another person, maybe, or imagining what would another person say to you. So when you're having these thoughts, these very self-critical thoughts, what would your best friend say? Is there another way of looking at this? So checking those thoughts and challenging them just with a bit of kind of gentle reality checking. The other thing to acknowledge with imposter syndrome is that in the short term, it can actually drive further success. So people might be more likely to work harder, to prepare more in advance for situations, to stay up later, essentially to put more effort to prove themselves that they are worthy. And so in the short term, this can actually drive success, and it's possibly a reason why a lot of successful people have imposter syndrome. But long term, it's important to be aware that actually imposter syndrome can drive burnout, exhaustion, and anxiety, which can actually make us quite unwell. This next question that's been submitted to us is about loneliness. So we've been asked, why do I physically feel lonely when I have people with me, but then I can feel normal around the same people at different times? So really great question. Loneliness is an emotion that all of us can relate to at different times, but it doesn't relate to being physically alone. So we can feel lonely even when we're surrounded by people. Loneliness is driven by a lack of connection, where we don't feel seen, we don't feel understood, and we don't feel cared for. It's not necessarily about being physically alone, but it's actually more about that lack of connection. So I've got a couple of tips on how we can manage this feeling of loneliness. And remember when I said loneliness isn't about being alone. So my first tip is don't necessarily chase being surrounded by more people. It's about experiencing more deep, meaningful social connections rather than superficial and volume of connections. My second tip is to avoid poor substitutes. So, a lot of us, when we're feeling lonely, will scroll through social media for hours, and you think that you're seeking out social connection or that you're distracting yourself, but actually sometimes it can make us feel worse because you get that kind of that comparator, the grass is always greener, and it looks like everybody else is having much more fun, that everybody else has got better relationships. Um, and it actually can make you feel worse. So be aware to kind of not to seek out poor substitutes. Excess use of alcohol, something else that some people will do as well when they're feeling lonely, hoping that it will facilitate social connection, but actually often it just makes things worse. It makes you feel more lonely the next day, and you realize that the social connections that you formed were really driven through alcohol, and they weren't really the kind of the same deep, meaningful connections that you might have formed if you were sober. And then finally, probably the most helpful tip is to build those social connections through activities that you enjoy. So if there's something that you, yeah, a particular hobby or an interest that you've got, or maybe it's, running or music or learning a new skill, that can be a great way to form social connections through an activity. And especially something like volunteering, where you're going to get that extra boost of dopamine from having done something helpful. And I also think as well, actually, a lot of other people who do volunteering, they're often good, kind, nice people. So great folks to surround yourself with. Can anxiety be a symptom of depression? Both anxiety and depression can be separate mental health diagnoses that exist separately. But what we often see is that they coexist, um, and they occur at the same time. So often, people who are depressed will often feel nervous and worried about the future, and people that are really, really anxious will sometimes feel low in mood. So they're different conditions, but they very, very commonly co-occur. And part of the reason for that is because there's a shared neurotransmitter. So that's a chemical messenger in our brain, which is dysregulated when we are experiencing a depressive episode or generalized anxiety. That neurotransmitter is called serotonin. So that's why often, regardless of whether somebody's got depression or anxiety, they'll get the same medication. So often we'll prescribe something called a selective serotonin reuptake inhibitor, and that's to increase the amount of serotonin in those kind of key neurological pathways in our brain. It also makes sense that there's this parallel relationship with depression and anxiety because they're often triggered by the same things like adverse life events, like the loss of a partner, the loss of a job, ill health. So often there's a common trigger for both depression and anxiety. People who are very, very anxious might become quite avoidant. So they reduce the number of people that they see. They spend more time at home by themselves. And so you can see how there's this natural pathway from reducing our social exposure to then feeling lower in mood and more isolated and more depressed. So this question is, why do you think EUPD or BPD still has such a stigma attached to it, especially for women? So for those of you who don't know, so EUPD is emotionally unstable personality disorder, and then BPD is borderline personality disorder. And these are mental health diagnoses where there is a cluster of symptoms that relate to our personality and how we interact with other people around us. And often there's kind of chronic feelings of emptiness, emotional dysregulation, like extreme emotional dysregulation from hour to hour, day to day, difficulty with sustaining relationships, kind of chronic feelings of self harm. There can be impulsivity, a whole cluster of symptoms, which can manifest in different ways with different people. Why I think that there is so much stigma related to these particular diagnoses, I think it's because it's poorly understood. I think people don't realize that those who are living with EUPD or BPD, they're not always behaving this way out of choice, and they're often really distressed, but they're not choosing to be distressed. And often stigma is attached to this idea of choice. There's actually lots of research on stigma with mental health, and particularly with addictions, because of course addictions is enormously stigmatized. And often it's because society thinks that people have chosen the addiction. Um, and so and with this idea of choice, there's also this idea of blame. And so people with EUPD or borderline personality disorder, it's often assumed that they're choosing to behave a certain way or choosing to react in a certain way. And although I do think it's powerful for us to all feel like we have this sense of agency, that we're able to um, respond to situations the way that we want to, the reality is that for some people with EUPD and borderline personality disorder, it's just really, really difficult. And the reason why it's more difficult for people with these diagnoses to manage their emotions is because there's a part of their brain called the amygdala, and that's um, part of the limbic system, and that's kind of like, I guess, like the epicenter of emotions. And for people with EUPD or borderline personality disorder, this particular part of their brain is a lot more reactive than it would be in somebody that didn't have one of those personality disorders. And often that's because of genetics, just because that's just the brain that they've been born with. But very often it's also because of a history of trauma. So there's this learned response to be hypervigilant for threats, hypervigilant for, rejection, and social dismissal. And so there's often this uh, overreactivity to situations and emotional stimuli, which somebody without one of these personality disorders may not react to in quite the same way. So, this next question, I've been asked, what would you say to somebody who had self harmed and had feelings and urges that they wanted to do it again? The first thing that I would check with somebody who had previously self harmed and told me that they had urges to self harm again, I suppose I'd be thinking like, are you safe? Are you okay? Are you in danger? And if you do not feel safe, then we've got some links below which you can check out to make sure that you're accessing care and support. The other thing I would also question or ask is, what's driving this urge to self harm? Um, Often it isn't about wanting to end your life. Often it's about meeting an unmet emotional need. So that could be a feeling of loneliness, it could be anger, frustration, sadness, self loathing. There's often some underlying driving emotional need, which self harming is meeting that need um, in a arguably dysfunctional way. The reason why I think it's helpful to name that underlying driver, that underlying need, because then if we understand what's driving it, then we can start to look at different ways of meeting that need and taking a really curious approach and, seeing, is there another way that I can make myself feel less lonely? Or like, is there another way that I can manage this anger, this frustration, or this sadness? What are the other ways I can manage these difficult, challenging emotions? And then the other thing just to acknowledge as well, this person talked about the urge to self-harm. So an urge is a very temporary, um, although it might be very strong, but it's a very temporary desire. And most urges pass within about 10 minutes. So my challenge to anybody who struggles with self-harm is to try and delay that self-harm. Now, again, I do lots of clinical work with people who've got addictions or compulsive behavioral disorders. And I often talk about surfing the urge. And so if you imagine that urge, that desire to act out the behavior, if you imagine it growing a little bit like a wave, and so over time, that urge gets bigger and bigger and bigger, and then it slowly falls over that 10-minute period. What I often challenge people to do is imagine that they're surfing the urge. And so not giving in to the urge when they're at that peak, when the wave is at the highest, when those feelings are their strongest, but actually just recognizing that this is a temporary state and that in 10 minutes time or so, that urge will have decreased and it won't feel so strong. best ways to kind of surf the urge are often with distraction techniques. So now acknowledging the feeling, it's there, it's okay. Not beating yourself up, but engaging yourself in a distraction technique for say 10, 15 minutes. The best type of distraction techniques are often activities which require active involvement. So, for example, maybe like playing the piano or going for a run or picking up the phone to somebody and having a phone call conversation, something that's actually going to engage you rather than a passive activity where it's easier for your mind to wander. So, something that's going to engage your hands and your mind is one of the best ways. Like I said right at the very beginning, if anybody's got any urges to harm themselves, if you don't feel safe or you feel like you're in danger, then please do check out our links below. Okay, so this question is, why do some anxious people get tics? And could they be neurodivergent? A lot of people who are anxious will get a nervous tic or like a little twitch. Could be their eye. It could be like even like twitching their shoulder. Sometimes it can be quite big movements. And the question here is, could they be neurodivergent? So the short answer is yes. They could have something called Tourette's syndrome, where there's these involuntary vocal tics where people say things that they don't want to say, that they just kind of happen. They're not always full words. It could just be grunts. But there's also physical tics as well, which might be kind of again small movements with kind of like say twitching. But it's important, I suppose, probably speak to a doctor, psychiatrist, just to see if these are actually tics or if it's something else. So if I was seeing somebody in clinic, my differential diagnosis for these movements, these tics, I would also be thinking about, well, is it actually self-soothing behavior? Is it like, so like stimming, for example, which a lot of patients with autism will stim. So that's kind of another repetitive movement. It's slightly different and different kind of pathophysiology from a tic. Um, but it may look the same or feel the same, this kind of urge to um, carry out like a repetitive movement. For example, like with children with autism, you might see them spinning. Or playing with like a fidget toy, but it's like self-stimulation. Um, but then also it could just be self-soothing behavior that you see with other conditions like anxiety disorder, or actually even emotionally unstable personality disorder or borderline personality disorder. So one of the self-soothing behaviors that I've often seen actually in clinic is repetitive hair pulling. So just kind of like pulling the hair, and a lot of people find that self-soothing. What's critical is to understand, is this a tic? Is it self-soothing behavior or is it stimming? And that'll help us understand what the underlying diagnosis, if any. So we've been asked, how do I help somebody who's experiencing derealization? So derealization can often be quite a bizarre or frightening experience. And it's essentially when we feel like the world around us isn't isn't real. Um, so it can feel like we're in a dream world, or as if we're looking through the world through like a lens or a looking glass. But there's just something that feels odd or strange, as if it's not we're not living in the real world. And in terms of how you can help somebody who's experiencing derealization, I suppose the kindest thing to do as well is when you're with them is to reassure them that they're safe, they're okay. Um, Not to read into it too much, not to kind of overthink it or encourage them to overthink the situation themselves. Um, but actually maybe to try like a grounding exercise just to ground them in the present moment where they are. One of my favorite, easiest grounding exercises to do is the five senses. So that's where you will ask the person with you to bring their attention to five things that they can see, four things that they can hear, three things that they can feel or touch, two things that they can smell or taste, and then one thing that they feel grateful for. And that experience of using their five senses helps to ground them in the world where they are right now and distract themselves from negative thoughts from the past, anxious, worried thoughts about the future, and just holding them here in the present moment.